Hello, my name is Sainte-Justine, and I'm currently a second-year medical student at Université de Montréal. I had the chance to work with the team of Dr. Prévost-Jean in the Sainte-Justine Research Center on this project, namely VITD, as a pilot double-blind randomized controlled trial on vitamin D3 in children with newly diagnosed Crohn's disease. Research has recently shown that vitamin D plays an important role in the modulation of inflammation by regulating the production of inflammatory cytokines, which are crucial for the pathogenesis of many immune-related diseases. Also, low vitamin D level is associated with a higher risk and a more severe course of Crohn's disease. Also, we know that varying doses of vitamin D can rapidly alter its serum levels. Furthermore, no study specifically addressed whether a supplementation of vitamin D can modulate its long-term level and the relapse rate of Crohn's disease in children. So the first aim of this project was to investigate if high-dose oral vitamin D as oral add-on therapy improve its serum level above 100 nanomoles per liter without any adverse event. The second was to evaluate if the high-dose vitamin D therapy was associated with an increase in the rate of sustained corticosteroids through remission. How about the methods used in this project? As I said, VITD is a pilot double-blind randomized controlled trial. Children aged between 9 and 18 years old, newly diagnosed with Crohn's disease for less than 3 months, with a pediatric Crohn's disease activity index under 30, were randomly allocated to one study arm, either the experimental group or the control group. So the first group was the experimental one, made up of a group of 12 patients. Patients over 40 kilograms of body weight took 4,000 international units per day of vitamin D as induction for 4 weeks, followed by 2,000 international units per day as maintenance for 48 weeks. However, patients under 40 kilograms took 3,000 international units per day as induction for 4 weeks and 2,000 international units per day as well as maintenance for the rest 48 weeks. The second group was the control one, made up of a group of 13 patients. They all took 800 international units per day of vitamin D during all the 52 weeks. Regarding results, 25 children, 14 girls, 11 boys, were included in this randomized controlled trial. The median baseline pediatric Crohn's disease activity index was 7.5. Baseline serum vitamin D was similar between the two groups, 65.5 nanomoles per liter versus 68 nanomoles per liter, as you can see in figure 1. The median induction vitamin D dose was 15.5 international units per kilogram body weight in the low dose versus 82.9 international units per kilogram in the high dose arm. Compliance to vitamin D intake was good, 95.3% at week 12, 94.7% at week 26, 95.8% at week 38, and 74.5% at week 52, for an average during all study long of 80%, as you can see in figure 2. In figure 1, you can see that blood levels of vitamin D gradually increased during follow-up. The median increase of vitamin D level was 38 nanomoles per liter in the high dose versus 4 nanomoles per liter in the low dose. The most important element demonstrated in this study is that at 52 weeks, 75% of patients in the high dose arm had serum level of vitamin D above 100 nanomoles per liter versus 12.5% in the low dose. The highest level of vitamin D at any time point was 206 nanomoles per liter in a patient in the 4,000 international unit per day group. No hypercalcemia or hypercalciuria was identified at any time point in the whole cohort. Also, a sustained corticosteroid-free remission by 52 weeks was present in 50% of patients in the high dose versus 40% in the low dose arm. In conclusion, a very good compliance with vitamin D oral intake was demonstrated in this study. Also, this pilot randomized controlled trial showed that high-dose oral vitamin D as oral add-on therapy markedly increases its serum levels without any drug-related adverse event. Finally, the study has been extended to 7 Canadian centers with the aim to investigate if the inexpensive therapy can help to lower the relapse rate of Crohn's disease to improve the quality of life of our young patients. Thank you.